Success.
Hey, girl, I am so hungry.
You pulled it together, though.
I'm pulling it together. Thank you. Yes.
Yeah.
No, actually, I woke up like this. What are you talking about?
I'm just trying to make sure that I have a way of multitasking here. So we have a second to like let people come on if they're going to watch live.
Okay. Whew.
So one of the I wanted to at least have something like go live quickly on my Facebook page, just but of course me trying to do that from my computer is a whole shebang. So let me just
No, what are you trying to do on Facebook?
I was going to try to go on Facebook Live and be like, go to Instagram.
Oh, okay.
But
now, can you somehow have it where you have both, like your Facebook Live?
I think that I don't know. You're at the I'm done with trying to figure out new things for right now. But yeah, I don't think I'm gonna be able to do it, so I'm gonna let that go.
All right.
All right. So yay. So we did it. We finally figured out how to at least get on one of these platforms. So I think that we should just start talking about what it is that we want to talk about. And the first thing I want to talk about is just to get a sense. Well, first of all, tell me a little bit about you and like why we're on this conversation together.
All right. So basically, I mean, I think it's an awesome idea. Like we have these conversations all the time about coronavirus and, you and I are both doctors, but we sometimes have different opinions about how things should be. And so I was thinking like, if people could see that we as physicians don't always agree and like just hearing the way we think, then maybe it might be helpful for other people out there listening. I think it's important because one of my main pet peeves at this point is the realization that people think science and facts don't quite matter so much. And so I think people should know, like, you are a physician trained in internal medicine and functional medicine. And didn't you go to Stanford?
Yeah.
Yeah. Right. So, okay. Legit. I'm trained in internal medicine and pediatrics, hopefully soon to be board certified in weight loss medicine. We'll see next week. And then MD from Medical College of Georgia. And then I have a master's in public health from Hopkins. So definitely not an expert on this and not even pretending to be an expert on this. But I do think that, we actually have some insight just based on our backgrounds.
Right. And so what is it right now, do you think that is the biggest misconception or the biggest confusion about what's happening for coronavirus throughout the country? Or what bothers you the most about it?
All right. So last night, my cousin, a dear cousin of mine, he posted this Facebook post, and it was from this guy who was saying why we should open the economy back up. And what really concerned me is like, if you read the guy's post, it really actually sounded like, he makes some pretty good points. But if you actually know the science behind it, you realize like, no, this just isn't how this works. This just isn't a good thing. But knowing that most people don't, well, like he was saying, what did he say? He was basically saying, not that many people die. So if you look at the percentage of the number of people who die is actually really low. And so are we really shutting down our economy when people are going to die if we keep the economy shut down? But so either way, he's like, people are going to die. So why not just open up the economy, because people are going to die. This is stupid. And so we have to take that chance. And, the reality is that people think, I feel like there's like this false dichotomy that says either people are going to die either way. So if we opened up the economy, we can save the economy. If we keep the economy, if we don't, then people die. And so open the economy and let's see what happens. And like, I'm not an economist, but what I do know is that if the number of people who could potentially get ill and sick from this occur, then our economy doesn't function anyway. And I think people forget about the numbers. Like if we do nothing, we're talking about millions and millions of people dying.
Right.
I don't think that's a small number.
Well, I think there are a couple of things that are misconception. Number one, if we had done the prevention early enough, we wouldn't have had as many people who are dead now potentially as there are, right? So I think it's all of the unnecessary deaths that are happening that people aren't really accounting for.
Yeah.
We also don't know the true number of people who are actually dying. So even though we're reporting the number of people who are dying and the number of people who actually are infected with this illness, we don't actually know the true number, because both me and you know that people aren't being tested, right? So the only people who get logged as being dying from COVID are people who were tested positive. And if you're only testing a very small amount of people, the number of people who have currently died far exceeds the number of people who actually have died from COVID. So I think that is one misconception. So when people are looking at the numbers aren't always telling a true full story. I also think that this idea that people are going to die anyway. Yes, there are going to be people who are going to die from this disease anyway. We could have prevented more people from dying, but we weren't able to because we started so late with our mitigation and our prevention strategies. But now that we're here, there are more factors to think about than just how many people are going to die immediately. We have to think about the fact that if a lot of people overload the healthcare system, like we saw in New York, people are going to die unnecessarily. People who might have gotten the illness, would have gone to the emergency room, might have not ended up on a ventilator, or even if they did end up on a ventilator, would not have died from the disease. So I think that's one thing of all the preventable deaths. And then I think when we think about the time frame, like, you know, this is going to be a long process of this disease sort of making its way through the United States, through the world. And we're going to see people are going to be getting sick over time. And we have to understand that if we gradually let people back into society, that we actually mitigate the number of people who are going to die over a longer period of time. So it's not just that people are going to die anyway, is that there are going to be a lot of unnecessary deaths. And the last point I want to make about that, about unnecessary deaths, is that it's not just people who are going to die from COVID, right? It's people who are going to die from heart attacks because they didn't go to the emergency room because of COVID. They're going to be people who choose to stay at home with illnesses that are life-threatening and end up not being able to get the care that they need. It's going to be people who go to the hospital anyway and then get COVID because the hospital has COVID patients in it. So there's a lot of unnecessary deaths that are going to happen if we don't make the appropriate decisions at the appropriate time. Now, you have made a really good comment that I want you to talk about why is it that, you know, why does opening the economy or opening Georgia today versus opening it in a month or in a week or in 3 months, like what makes the huge difference there? Because obviously we're going to have to open at some point, but what's the difference between opening today versus opening later?
Girl, okay. So I think there's so many points there, but I'm going to try to keep it brief. And like, one of the things I said to you is that we are getting better at treating COVID, right? So it's not even just about capacity. It's about us as physicians understanding the disease, understanding what works, understanding how do we better treat people. And so just in the past, month or so, you know, at my institution, there have been so many breakthroughs. And when I say breakthroughs, you know, like proning patients who have respiratory issues, so turning them on their stomachs improves their ability to breathe and keeps them off vents. We didn't know that at the beginning. So like my thing is, if I'm going to get this, and there are some people who say, hey, everybody's going to get it, what's the big deal? If I'm going to get this, I don't want to get it now. I want to get it in 6 months. I want to get it in a year, you know, when doctors actually know how to treat this. When I go in, they're like, oh, you know, we're going to give her this much oxygen. If her oxygen needs go above this, we're going to have her turn on her stomach. You know, we're going to do some tummy time. We're going to do all these things. You know, another really big thing that came up for us about 2 weeks ago is the realization that a lot of people are having thromboembolic events. You know, they're having these blood clots. Yeah, they're having these blood clots. Well, I'm talking to you, right? And so they're dying of, you have young people who are dying of strokes. You have young people who are having blood clots in their lungs and they're dropping dead. And so they're like, why are these people dropping dead? And we're realizing that people are clotting. Whatever it is about this virus is causing clots. You know, isn't there that actor in California who had a blood clot in his leg because he had coronavirus and they had to amputate his leg? And, you know, he's actually been on the vent. They haven't been able to.
Oh, yeah, I saw that.
Yeah, and so the reality is that, so now in my hospital, what we're doing, everybody who comes in and they have COVID, you know, we have protocols where we give them blood thinners. And so it's a different level of blood thinner depending on like how sick you are. But we weren't doing that in the beginning. But now we know these people get blood clots. Let's do blood thinners. So my thing is like, if you get this, you don't want to get it now.
Right.
And that's something that I think we have to remember. We are going to get much better at treating this disease. We're going to get much better at diagnosing this disease. And so there's a lot that needs to be in place before we can safely open up the economy. But one, give us a chance as physicians, as doctors, as healthcare providers to be able to give you the best chance.
Yeah. And I think the other thing about that, I think that's an excellent point about, like, I don't want my mother to get this now. If she's going to get it at some point, I want her to get it like a year or two down the line if possible. But I think we also have to have the appropriate structures in place to allow us to do the things that keep it from spreading at a rapid rate. So the things that we've been talking about, just testing. The thing that really frustrates me about this whole talk about testing and saying, oh, well, some places have enough testing. We do not have enough testing until we can test everybody. I mean, everybody, people who have symptoms, people who don't have symptoms. And right now, if you have symptoms and the symptoms don't seem severe, then we are not going to test you. So we don't have enough tests to even test people with symptoms. The people who are getting tested are the people who are getting admitted to the hospital. So we need enough tests, not just to test the sick people. We need to test the people who are well, because we don't even know what the penetrance of this disease is. We don't know how many people have it. We don't know how many people have had it. So looking at antibody tests is going to be another really big thing. And then when you open the economy, what people have to understand is that the epidemiologists around here have to be able to identify people who have the disease. And then they do this, scientific situation where they go off and they find everybody that person has come in contact with. And then you're able to notify people that you should be in isolation. And that is the way that true contact tracing is supposed to happen in a ideal situation when you're dealing with the epidemic or a pandemic. And until we have those basic things, I mean, I hear some of the scientists talk about, they've modeled what they would do in the event of a pandemic, but we weren't prepared for this pandemic. And we're still not prepared for this pandemic. And it's that slow response that is drawing this process out of when we could reopen. If we had tests at an appropriate time, if we had contact tracing available, if we had an actual system in place, 2 months ago, then we could have opened the economy. As a matter of fact, it might not have even been in a situation where we had to close the economy if we had got on this fast enough. So the reason we're suffering at this point is because we're behind the 8 ball, and we can't rush it because, just because we want to. We have to take the appropriate steps. Now, I saw somebody had made a comment, said something about why are people not telling the world how real the ideal of the great length of time return. Okay, so why aren't we talking about how long this is really going to take? I think there are a couple of reasons for this. Number one, because we don't know. I think that this is rapidly changing. We don't know enough about the disease itself. So we don't, like I said before, we don't know how many people, how infectious this disease is in a population. The only way you really get to know that is by testing swaths of people. And because we haven't done that yet, we don't know how many people have had it, how many people have gotten well, or recovered from the illness. We don't know the immunity. So we don't even really know that if you get the illness, when would you be able to get it again, or if you'd be able to get it again? Are you immune to getting it again? We don't really know the true answer to that. We could guess based on other coronaviruses that have been that we've studied, but we don't know that for sure yet. So I think there's a lot of unknowns. But I also think there is some misleading going on, because when people talk about reopening the economy or reopening states, it doesn't mean we get to go back to normal, right? The fact is that this disease is going to be around, and as long as the disease is going to be around, there are going to be people who are going to get infected and die from this disease, no matter what we do. And that is going to be a true reality for us until we have a vaccine in place and we have better treatments in place. And that, obviously, they do talk about could take a year and a half. For me, when I think about this, even when the economy opens up, I still don't want my mom going out. I don't know what I'm going to do with my kids during the summer, because if my kids go out and they get exposed, then that means that I have to keep them away from my mom or my husband's parents, right? So there's this distance, this social distancing is going to be a real reality for us for at least another year, a year and a half, maybe 2 years. So normal is not coming back anytime soon. And I think people are saying that, but I don't think people are really getting that. They don't really quite understand that. I don't know how you feel about that.
Well, I think the first thing is that we got to talk about setting realistic expectations. You know, we live in a world where whatever you want, you get it now. You know, you have the internet, you have IG, you want your food delivered, it comes now. Everything's like just really quick. And the realization is like we're learning stuff in real time. So I hear a lot of people saying, they don't know what they're talking about. They tell us one thing today and another thing tomorrow.
Mm-hmm.
And yes, that is what it appears to be. But like we are literally learning information in real time. And then once we get something, once we're like doing studies, there are lots of places doing studies. And then typically the way this whole process works, somebody does a study, they get funding, they do the study for, 6 months to a year. Then they have to get the study peer reviewed, and then they publish it. And then we finally get the results of the study 2 to 3 years later. We're just not doing that now. So literally people are doing studies. They're publishing those studies immediately without them being peer reviewed. So some studies are good, some studies are not good. But like we're in this space where like we need information now. Right. And so I don't want to wait 3 years to find out, oh, I should have been giving my patients blood thinners. And then maybe, your mom or your son wouldn't have had a stroke or wouldn't have had, a heart attack. And so I think so we're getting this information. As soon as we get it, people are putting it out there. And so I think that's why you're having this thought of they're either lying to us, they're not telling us the truth, or they don't know what they're talking about. Right. And because there's not that understanding that this is a moving target, there's so much that we don't know, and we're learning all of this stuff in real time. And instead of there being this, this process where, some things get reported in the news, but like the lay public doesn't know it. Everything's like in scientific journals. Like, no, everything's out there. It's on Twitter, it's on Instagram, it's like there. And so it's a lot of information to filter through. And I think people have to show some grace and have an understanding that people aren't lying. They're telling you what they know today. And then when they get better data.
Wait, people are lying. Let's get
okay.
There are people who are actively lying about what's going on. So let's be clear about that. But I do agree with you that there is a sense that nobody's telling the truth. And there are people who are trying to tell the truth. They're telling the truth that is active to right now and today. And that truth is going to change, right? But yes, there are people lying.
Okay.
And the problem with people lying is that there are people who really believe the people who are lying. And then there's also just a lot of confusion. So there are people who are saying something, and like I saw some lady, she posted, it was really good, where she talked about what the truth of COVID was. And she was saying, wear a mask, don't wear a mask, go outside, but don't go outside, stay inside, but don't only go outside if you need to go outside. It was really funny. But the idea is that nobody really knows what the truth is. So nobody can really filter through what the truth is and what's a lie. And that's one of the reasons why I think it's important for us to have these dialogues, to talk about what this moving target. That's the great thing about having, instant knowledge being able to be distributed to people in the time that things are happening. So,
and then, so back to your point about people lying. Yes, we do have a system in place where if you speak the truth, there's the risk of there being punitive measures. Like you have to be careful what you say. One of the, there's a mom here in the city of Decatur, who she works for the CDC. She's a director at the CDC. She was saying back in February, hey, this is a problem. This is going to spread exponentially. We have to do something about it. And, the stock market crashed, shit hit the fan. The president was looking at firing her. And so you realize there are real life consequences to when people do speak the truth. And so, okay, you're right. There are people lying. But then that brings me to another good point then. So that also says that you need to be so careful about who you're getting your information from. So what are your sources? Determine what your sources are and determine, so you'll know, is this factual? What is this person's, the guy who wrote the article I was talking about, he's in the financial industry. So his focus is to get people working so he can make money. And so understanding, is this person in finance? Is this person in medicine? Is this person in politics? Because that can also kind of help you understand, who do I listen to? Who do I trust? Especially when you're getting so much contradicting information.
So I wanted to go, somebody else had asked a question. that do we think that there are going to be enough tests that we're going to be able to test everyone? So what's interesting here, because I do functional medicine, and I use a lot of specialty labs. And if you wanted to get tested right now, if you want an antibody test right now, they are available. You'll have to pay for them. I think they run somewhere between $99 and $149, sort of at the lab's cost. And so if anybody wanted to get tested, if you had a doctor who had access to one of these tests, you could get the test done right now. You just have to pay for them. The big
But that's
issue,
the antibody. Wait, that's the antibody testing now. That's not the actual testing to see if you have the disease.
No, yeah, both. I'm telling you, no, they have tests for both. I've been contacted by 3 or 4 different companies. I mean, a lot of these boutique lab companies, they got on this at the moment that they knew it was going to be a thing, and so they started validating, having FDA approval for these tests right off the bat. So yes, you can get antibody testing. You can actually get COVID to test if you actively have the disease, and so which we can talk about disparities in who has access to these sort of specialized labs, right? Yeah. But there are these labs out there, so everybody could be tested. What people are talking about in the news is, do we have enough tests to test everybody widespread, whether or not you have access to these specialty tests or not? And the answer to that is apparently no, because even within both of our hospital systems, although we have tests to test, some people, we don't have enough tests to test everybody. So the question of I think we're going to have that number of tests, that is elusive to me. I have no idea why we didn't take the test from the World Health Organization that they were using across the world. I know there were some problems there, but that's how other countries had started. If we had started...
No, you know why. You do know why, right?
No, why?
So one of the reasons we didn't take the test from the World Health Organization is because there are already agreements in place here. There were companies and labs here who had made testing, and there were agreements that they would get first dib by providing testing.
I do know why the economic reason is.
So the economic reasons, yes. Right. There are economic reasons why we have not been able to test our people, why we have not been able to actually prevent, this disease from spreading the way it has. But anyway, so yeah, right. So I'm sorry, because you said you didn't know why. So I just wanted to make sure.
No, but I mean, I assumed, I didn't know if it was sort of like my own conspiracy theories that it was all a financial thing.
No, this was
there was like some other, because even on the major news stream, people aren't really saying why we didn't have the same access to tests that other countries around the world had access to.
We refused it. We chose not to use it. And, the reality is, like, even at the state health department, the state health department had tests. And there were local labs who were going to the hospitals, going to providers and saying, hey, we can do this testing. And the state health department was saying, no, you can't use those tests. Mm-hmm. So why is it that you only, initially in this, I remember we would say, oh, we can only do 30 tests a day. Mm-hmm. And then it got to the point, we can only do 300 tests a day in the city of Atlanta. Like, are you kidding me? Mm-hmm. And so we didn't have the capacity, but we didn't have the capacity because we were being limited to the state health department's test. Mm-hmm. And once we got to the place where we were no longer being limited to the state health department, I mean, where I am, we have the capacity to test all of the healthcare workers. And we're actually moving into the phase where we're testing people who are asymptomatic. So if you want to get tested in my healthcare system, you can get tested. And but it shouldn't be in my healthcare system. I'm in Atlanta. Mm-hmm. There are lots of healthcare systems here. How is it that my healthcare system says you can get tested even if you don't have symptoms, but then other healthcare systems don't have the same capacity? I mean, mm-hmm. I think that's a little ridiculous in terms of like the fact that we're not sharing the resources that need to be shared, and where, there's just so much competition. But mm-hmm. Yeah, let me see. So then I know Christine asked, even at the CVS testing place, do they have to have symptoms? And so, like, I don't know now, like, what the criterion are for is like the CVS, Georgia Tech, like those places that are doing the testing. Mm-hmm. I do know that a lot of the decisions that have been made have not necessarily been based on best evidence or, best practice. It's been because we've been limited. And so I think that really just goes back to your point that we need to be able to test people. And then when you talk about whether or not it's safe to open the economy, I think like something else when we talk about, like, can we open the economy? When can we open the economy? So on the White House actually has a resource page says guidelines to opening up America. right? So it's like very clear, like what the guidelines are. And part of those guidelines are that you have widespread testing. And then like you were saying, Nicole, because we need to know who has it quickly. We need to know so we can trace their contacts, so we can quarantine people. And then so that way we can decrease the spread of the virus in the community. And then something else Georgia didn't do is we were supposed to have at least 14 days where the number of cases were going down.
And that's absolutely not happening.
It's not happening. And so it's just one of those things where like, this is public health stuff. This is just all public health. You know, we know how to do this.
Yeah.
We know how to do
Which
this.
is why we're so frustrated. It's because this isn't rocket science. I mean, it's not rocket science to scientists, right? Scientists know how to do this. And the fact that everybody's out here acting like scientists don't know how to handle the situation is really frustrating, because we do have the resources, we do know. And if we had been under a different, you know, political system, possibly that we would have had different actions be taken, and it would have been, you know, a different outcome. I did want to make a point. Somebody had asked the question, is the antibody test the same thing as the COVID test? And it is not. So basically what the COVID test does is it actually tests you to see if you have active disease. The antibody test sees if you've developed immunity, some form of immunity to the actual virus. So that means you've had it and you've developed antibodies and you've now cleared the disease. The reason that's important is that if you have antibodies, it could mean that you can't get the infection again. And that's what this idea of herd immunity is that everybody gets the disease and then everybody becomes immune to the disease. And so now you can't get it again. The problem with that is that we don't know for sure whether or not if you've had the disease in the past, how long you'll have immunity for. So does that mean if I got COVID in March, what people are presuming is that it will be something like the flu vaccine where, or a flu immunity where you might have it for about 12 months and then your immunity sort of wanes away. But we don't know that for sure that it would even last 12 months. We're seeing, at least I'm hearing some reports that in Asia that they're finding that people are either having reactivation, meaning that their antibodies are being the virus is being reactivated in their body, or they're being reinfected. And if that's the case, then that's a whole totally different ball of wax. That means herd immunity isn't something that's going to be protective. And so we don't really know the answer to that, but we can guess that it might be helpful because we know how most viruses act and we know how coronaviruses act, and usually immunity should be able to last. So those are two different tests. That's why we need both of them. I know for myself, if I know that I have had the disease and I have immunity, then I would be more confident about going out knowing that if I got exposed that I wouldn't get the disease. If I knew my mom had it, it would make me so much more comfortable with being able to tell her, yes, you may go out and be happy and merry in the US, you know, and not fear getting reinfected.
Okay, but I have to say something about that immunity though. And you said it in terms of like, we just don't know how long immunity lasts. So is it like a common cold where you can get a cold, you know, today and then you can get another cold in 3 months? Or like, is there true like long-term immunity? Mm-hmm. And so I think people have to know, like, once again, it's just stuff that we just don't know. And they're trying to figure it out. And, you know, you're going to have somebody put a study out there that says, looks like immunity is this. And then you may get somebody put a study that says 6 months later, like, actually, oops, we were wrong. Turns out the immunity is actually this. And then also understanding, just like the flu, you know, the coronavirus, COVID-19 or SARS-CoV-2 is like the official virus name, is that it's mutating. Mm-hmm. And so if it's mutating, so what we know about, go ahead, Nicole.
No, right? That's a whole other, carry on, please.
Right. And so that's the thing. So you're like, wait a minute, I thought you guys knew. And it's like, well, no, because if this virus mutates, because the reason, with the flu, like we know that the influenza, it mutates. That's why we have different strains. We have like hundreds of, well, I don't want to say hundreds of strains. You might know better than Nicole, but we have a lot of different strains of the flu. And so this is why, like every single year, they're making a different flu vaccine, trying to cover the strains that they think are most prevalent in the society. And so like, it's just like, we don't know with coronavirus if you're going to have immunity, and then is it going to mutate, and is there going to be a different strain? I mean, there's just so many unknowns. But I think it goes back to before you open the economy, because that's what we're talking about, right? We're talking about is it safe to open the economy in Georgia? And before you open the economy, you make sure you have testing. You make sure you have the public health systems in place where you can actually do contact tracing for the patients. And how about we have some public health measures? And if you look on the website, like the guidelines of opening, they talk about this, where everybody needs to wear a mask. So I'm sure, you know, most people, and I'm one of those people, like, this is ridiculous. First you say don't wear a mask, then you say do wear a mask. First you say cloth masks don't work, now you say cloth masks do work. And, you know, we can have a whole conversation about masks because there are so many nuances about which masks are better. Which masks protect you from COVID versus which masks are basically public health measures that are protecting everybody else. But I think we can absolutely all agree that everybody needs to wear a mask. You shouldn't leave your house if you don't have a mask on your face. And I don't see any public health campaigns telling people wear a mask. And I think that's a huge miss because that is something we can do.
Okay, so I do think that they are pushing the mask thing, and I actually did a video.
Who's pushing? Huh? Who's pushing it?
I mean, they keep talking about it. Everybody should be wearing a mask. I think that's a thing. That's a thing now. I think. Okay. I mean, and I had done a whole video about why we didn't need to wear masks, and I think the issue is that one of the things, like you said, there are different masks for different things, right? And there are different reasons why you might wear a mask, right? But I think the general consensus now is that everybody should be wearing some form of a mouth covering. And I think we have to be clear about the difference between a mouth covering and like an actual surgical mask or an N95 mask and all of these different nuances. But I think, you know, whenever we give public health information, we give the information that is going to be most helpful to the most amount of people without getting too technical. And I think right now we're talking about using mouth coverings that might limit the extent to which the virus can live or exist in the air. But it doesn't mean that it's not going to go through that mask. I mean, the reason why we use N95s in the hospital is because we know the virus is small enough to go through the little particles in a basic surgical mask. So I do think that wearing a mask is sort of general consensus right now, that everybody should be wearing a mask. I don't think that people should be under the false impression that wearing a mask and wearing gloves is going to that you can prevent yourself from giving it to yourself. If you touch a mask that's been infected and then you put your hands in your eyes, then you're going to transmit it just like if you had no mask on, right? But I think people need to understand the nuances of this. But I do know that if I'm talking to you, Kanika, and we are, you know, within a distance, I mean, I guess the standard is 6 feet, but now we're wondering if that's even long enough. But if we're talking that if I breathe in your direction and then you breathe in that air, that you get a chance of getting infected. But I think the other thing beyond masks that I think is probably more, not more concerning, but just as concerning are surfaces, right? So it's the touching of things that we, you know, touching of doorknobs, of the elevators and all of these other things. So I don't want to get sidetracked on just thinking that masks are everything. We definitely need to do it, but we also need to start thinking about, you know, the surfaces that we're touching and the people that we're around and who's going to touch those surfaces. So there's a lot, I think, to unpack there.
Okay, but since you mentioned it, since you went into the mask or mouth covering a little bit, I feel like I have to say two things. One is when you're wearing a mouth covering, and I guess we're referring to cloth mask, right? Is that what you're calling them? So if everybody wears a cloth mask or mouth covering, then what that does is that when you sneeze or when you cough or when you speak, if you have coronavirus and you just don't even know it, then it keeps the majority of those particles inside of your mask instead of being out there on those surfaces that Nicole was talking about or in the air. So like if everybody did that, it would just decrease the amount of viral particles out there in the surface, in the air, period. And I think the other thing that you talked about was, you know, about how to take these masks and put them on and put them off, you know. So my husband, for me, is like a prime example. Like I tell him, like, Jason, you just touched the mask. Now you have to go and wash your hands. And so it's like, you cannot touch this mask. And so like now he knows, because he calls me a drill sergeant, but like he knows that if he puts a mask on his face, he does not readjust that mask. He does not touch that mask. He does nothing with that mask until he is back home, mask is off, hands are clean, mask is off, hands are cleaned again, because people are infecting themselves. Because if there is coronavirus on that mask, then you just touch that mask, rub your eye, and just rub it into your eyes. And so you completely defeated the purpose. So I think, once again, so I don't know. I haven't seen the public health, you know, outreach or PSAs, public service announcements that are telling people, look, not only do you need to wear a mask, but this is how you put it on. This is how you take it off. Like, I've seen people wear bandanas where they put the bandana up over their face, and then when they're no longer around the people who they're worried about, they pull the bandana down to their neck, and then when they go back to around other people, they pull the bandana back.
Right.
You just touched all the corona that was on that mask.
Right.
And then it's probably just rubbed it into your face.
My mom, I remember, this is about gloves. She had, you know, I had gotten such on her, and I'm a drill sergeant for her, and she would go down the elevator in her building, and she would wear gloves, so she was real proud of herself. She had her mask on, and then she would get in my car, and I'm like, take the gloves off before you get in the car. But, you know, that's my point. My point is that if you don't know how to use it correctly, you're not going to protect yourself. You're not going to protect yourself with having that mask, but you could, like you said, prevent other people. So anyway, do you want to touch on this issue of social disparities, or you want to leave that for another day?
Oh, so I think it's been like, what, 37, 40 minutes or so. And so I don't know. I think
let's leave for another day, but I do want to talk about it.
Wait. Yes, I want to talk about it. But I do want to say, if there's anybody, because like we were looking at the questions, if there are any other questions, any other things people have, if you put it in right now real quick, then we can maybe touch on it before we get off. And then Nicole, I wanted to ask, like, so is this recorded?
I think so. You know, neither one of us have any Instagram live experience, so we'll do our best.
Yeah, I don't know if it's recorded. I don't know if
I think it is. No, we can post it on our page afterwards.
You think so? Okay.
I know so. I know. I do know that.
All right. No, but I think this is really good. I think it was
I want to, let's come back on like another day and talk about health disparities, and talk about, you know, what we need to be doing as a community to sort of prevent the spread within our community. I would want to leave with this, though, that particularly for those of you who are Georgia residents, we are not listening to the governor in this case. We are not following his directive. I want people to be very cautious about who they get their information from. Listen to the scientists, listen to the doctors. If they are not concurring with what political leaders and economists are saying, follow the scientists. You can prevent yourself from being one of those people who get this disease early on. And you want to be a person, if you're going to get it, you want to be a person who gets it later in the course of this, when doctors and hospitals are more prepared, and that people aren't overly stressed and taxed. Please know that the healthcare providers right now who are working on the front line, they are stressed and taxed. This is a very stressing time. So don't get sick now. Like,
don't
go
get sick.
outside now.
Yes, I agree. And I think that was really important what you said, leaving with that thought, like what we're doing. So like very practical things, like my daughter's birthday is May 25th. We're not having a huge party. We're not, the only people at that party will be the people in this house. And that's really sad for her because she has best friends. We always have some type of huge celebration, and it's just not happening because it's not safe. I've canceled all of our summer camps. My kids do swim on swim team every single year. And I am like devastated, but there will be no swim team this year. So I think people need to understand we're in this for the long haul, and that this is not going to be business as usual. And so just go ahead and embrace that, get it in your spirit, and just know that there are those of us who are listening or seeing Trump, hearing Kemp, and we're like, no, we will not be out there in those streets. No. Just FYI.
And let your mamas and your aunties and your uncles and your cousins, and let them all know that, because we also don't want this to be a pandemic that goes down in history as killing off, you know, hundreds of thousands of Black people unnecessarily. And please believe that if we were to follow the instructions of those people who, you know, Trump, Kemp, the whole nine, that many more of us will die, and we have to really look out for ourselves. And it's just, you know, we all in this together, and we got to take that seriously. And I think that, you know, lastly, just to sort of leave on a positive note, there could be a lot of good that comes out of this. So take this opportunity to sort of understand that this is a new normal, at least for another 12 months, and see how you can make the most out of this situation financially. You know, I know a lot of people are struggling. We need to be looking at alternative streams of revenue if you're not able to go back to the job that you previously had. So, you know, start thinking that way. I don't want people to think that, you know, once somebody does give the okay for us to go back, whether that's May or whether that's June, that things are going to go back to things as normal. Stack, you know, save as much money as you can possibly save at this point, because the economy is going to suffer, and we have to be prepared for that. But also just be thinking this is for the long haul. So we need to start making adjustments that reflect that.
Okay, so there are two questions. I think we should answer these two questions before we say bye. Okay. I'm going to take the first one, and then I think the second one is good for you. Any recommendations on where to go get masks? So that's a hard one. You know, there are tons of groups, you know, Facebook groups, places where people are making the cloth mask. Looks like I think you can probably get those on Etsy. Like there are lots of places now where they're selling the cloth mask. For me and mine, I mean, quite honestly, I really prefer a surgical mask. And so the thing with the surgical mask, I'm just going to say this. When I told people I needed masks, one of the places where we found surgical masks were at the beauty supply stores. The Asian beauty supply stores do have surgical masks that they have, you know, I mean, just being real, that's where they have some. So like, if you can get some, it's just good to know that's one of the places where you can look. Please don't hoard, people, because if you do have access and you start hoarding all these masks, and it does mean that those of us on the front lines in the hospitals, your paramedics, your police officers, etc., they won't have the masks that they need to stay safe. So be mindful of not hoarding, which is why we're not really recommending the surgical mask or the N95s, because like we just don't have enough at this point. We need them in the hospitals. So really hoping that more people will do the cloth mask. And if everybody does them, then that gives us a measure of protection. And Nicole, we have someone asked about the prevention, you know, natural things you can do for prevention. I know that's all up your alley.
That's all me. That's all.
Yes.
Me. Okay. So there are a lot of things that I think one of the things when we talk about illness, we kind of think it's something that happens to us and that we don't have anything that we can do to help prevent it. Now, I talk about this in some of my other videos. So if you get a chance, go into my Instagram page and you can look at my videos. But I have to give the caveat before I give any recommendation. The first caveat is that nothing has been tested in COVID. This is a new virus, and we do not have any evidence that a specific pharmaceutical or supplement or botanical will be effective. Definitely not to treat, but even for the purpose of prevention or lessening the severity of disease. But what I've been taking myself and what I've been recommending to my patients would be really things that we already know have been helpful when we talk about viral illnesses. So before I get into supplements, the first thing I would say is just some of the basic stuff. Sleep, 8 hours of sleep. If you are not sleeping, if you are taxing your sleep, you are also taxing your immune system. So I know that seems like the simplest thing, but it's the most important thing. Get at least 8 hours of sleep. And then also eating really well. Obviously, I mean, I've been eating things that I normally don't eat. I let my kids eat things that we normally don't eat because otherwise I will strangle them in this house. But if you can, if you're really, this is a great time for you to, you know, take up eating a more healthful diet that's going to be health promoting. And what I mean by that, primarily the two most inflammatory foods that I tell people to try to avoid if they're getting sick would be dairy, and then a ton of, you know, refined processed grains like bread. All right, so those would be like sort of the two main lifestyle things. The other third main lifestyle is going to be stress. And obviously we can't control stress, but we can manage stress. So this would be a great time to take up meditation, taking long walks in, you know, the forest by yourself, or just outside, get the sunlight. Now, when we talk about supplements, there's been some controversy about whether you can take vitamin D or not. Vitamin D, there's some thoughts about it, like actually hyping up the immune system. There's no real precedence for that. I think that's a theoretical. So vitamin D has been shown for many other reasons to be helpful and preventive, or at least immune boosting. So I would say vitamin D. Vitamin C is also another really great antioxidant. And then there are also a lot of other botanicals that too much for me to get into now, but things like I was going to say echinacea and elderberry, but they haven't really been studied as much as quercetin and what am I thinking of? EGCG, which is green tea extract. So there are a lot of different things that you can take. If you're interested in knowing more about that, I am going to be releasing a course on botanicals you can do to boost your immune system. So if you're interested in that, just stay tuned. As soon as I get some time, I will make it. And if you want to check out, if you go to my website, drnicolepeoples.com, there is a there's a store there where you can access professional grade supplements. If you go to my YouTube page, Dr. Nicole Peoples, I think it's, yeah, Dr. Nicole Peoples, there's some videos on there about this very topic and how to access the professional grade supplements that I have access to. So, long answer.
All right. Well, I'm going to go spend some QT with these kids. I'll see you later. All right. Bye. Thanks, guys, for listening.